My name is Dr. Bethany Vibert, and I'm a clinical psychologist at the Child Mind Institute. We're a national nonprofit that supports children and families with gold standard mental health care, advice, and resources, all online and accessible to everyone. During the coronavirus crisis, our telehealth resources include diagnosis and treatment of mental health and learning disorders, 30-minute phone consultations, bereavement and grief support, remote psychological and neuropsychological evaluations, and a little bit more. That's just a sampling, so please visit childmind.org/telehealth to learn more. Today, I'm here with you to talk about autism and behavior during reopening, as well as a little bit about telehealth, and answer your questions about that and anything else you're worrying about. Post your questions in the feed, and we'll also post some helpful links and resources on childmind.org. Remember, we're here every day and we look through your questions daily. To get started, as you guys post your questions and get comfortable here, I have a few questions that have already been submitted. And one of them has actually come up earlier when the coronavirus crisis sort of started and everybody was homebound. And since then, we've actually put a lot of thought and other resources into how we can truly help families during this time. And so I want to revisit a question that I've gotten earlier as well. One of the families wrote in and said, we were right at the beginning of the assessment process when all of this started. We want to forge ahead, but we're really not sure how a telehealth assessment for autism will work. Can you help me understand what to expect? So I think this is a great question, and considering that some places are starting to reopen and other places might be going a little bit slower, you do really want to be conscientious of the services you're selecting for your child right now and how you're going about picking a place that's going to provide you those services, and to know when to jump in and how to do so. So what I wanted to start by answering that question is really reminding you that a telehealth assessment for autism is going to have many of the same components that an in-person assessment would have. There is going to be a little bit of a difference in the types of measures that you're using, more so because as clinicians, some of the measures that we're used to using in person especially are really just not plausible to do in a telehealth platform. So we might be using some different measures, but the kind of core components of an autism evaluation are actually going to remain the same. So if you're pursuing a telehealth evaluation, which is a good idea because you're probably wondering some things about your child, you want to get accesses to services and help them as quickly as possible, here's a few things to make sure that we keep in mind when you're searching for that. So first, an appointment with parents only is always really important. In that appointment, the clinician should really be asking the parent history and information about the child, why you're coming in, what the concerning behaviors are, and get a thorough developmental history about your child. It may be a little bit longer or shorter depending on the age of your child, but that initial interview with the parents is very, very important and is key. The other thing that they should be talking about during that interview is not only developmental history, but your child's social skills, play skills, and other kind of components and behaviors of their day-to-day life. Another key component to an autism assessment are standardized parent measures. Those might include some questionnaires that are sent out. They can be done in the form of an interview in some instances, but you want to make sure that there are some standardized parent questionnaires included in your assessment. These questionnaires are going to be related to, again, your child's development and behavior. Another really key component to any evaluation, especially of children and especially for autism spectrum disorders, is a child observation. This is going to be key and can definitely be done via telehealth. There are a lot of ways that as clinicians we can get creative and get those types of observations from you guys. And one of those ways is actually by parents submitting videos. So as a clinician, we can ask you to set up certain scenarios with your kids, whether that is a meal or playing with bubbles or playing with toys. We actually get a lot of information from, different types of setups or different types of behaviors that we're looking for and their interactions with you. The other thing that we can do is also a live observation. So maybe this is just a combination of the two, some setup examples and some live observation. This may also depend on the age of your child, depending on if we can have a live interview with your child or really a live interaction with your child, or just a live observation where we're asking you to set up certain scenarios with your child. we can get a lot of information from these observations. Another aspect of the assessment is going to be standardized measures with the child. This can be done via live setup again, where we're setting up certain things or asking certain questions live with your child, or where we're asking you to, the caregiver, to set up certain scenarios that are going to be helpful for us. We really do get a lot of information, whether it's watching the child interact with you or interact with certain materials. It can really help us understand your child and their developmental ability, their social skills, and their behaviors. Lastly, a really important part of, I think, any assessment and evaluation is going to be that feedback session with you guys. So, you're seeking out this evaluation to get help and information on your child. And so a real thorough assessment should include feedback and information for you as the parent. In addition, with that feedback session, an important component is going to be some really specific and clear recommendations. So you obviously reached out to get an assessment or an evaluation because you do want some help or some guidance. And so not only should a clinician be able to tell you if there is an appropriate diagnosis for your child, but then also what to do about it. And so a really clear list, concise recommendations for you and your family is going to be essential. So those are some important components to keep in mind as you search for the appropriate telehealth provider for an autism assessment. Another key component to consider is that it may be very important that you do some sort of an in-person follow-up once regulations change. Again, the whole idea of an assessment is not only to get appropriate diagnosis, but also to inform intervention in an educational setting. And so when you do engage in an assessment with a provider, asking them what their plan is for follow-up, if they're going to need another appointment, and if and when they're going to need another appointment, I think is probably the best question, to really go back and connect with them, set up those expectations with the provider first, and know that when you do return to school, when your child is returning to the community, behaviors may change, things might change, and so you want to kind of set up a plan with the evaluator for if and when that happens in your community. So I think that all of those things are really included in an in-person autism evaluation, that parent interview, standardized measures, direct observation of the child, feedback, and then hopefully thorough but concise recommendations. So as you do seek follow-up or a further assessment for your child, it's important to keep those things in mind, whether it be via telehealth or in person. We've definitely, started to see a lot of success with these sort of telehealth evaluations, and I think clinicians, especially here at Childmind, are eager and excited that we're able to do these and still help families like yours that are seeking an evaluation and want to kind of jump into treatment and get some recommendations as soon as possible. So I hope that was helpful and answered some of those questions about what an evaluation and an assessment can look like in the time of telehealth and not really necessarily knowing if we can be in person yet. So as I talk about telehealth, another very common question and comment that we get from parents is about how telehealth can be actually helpful and setting up an optimal telehealth session. So one parent wrote, how can I make telehealth appointments for my daughter work? A lot of parents, I think, are hesitant and concerned, or they've had kind of bad luck with them in the past. And so as you head into either continued telehealth appointments, or maybe you've been home for a while and you're feeling like you do want to reach out and get some services if behaviors are changing or things are coming up at home. And I think that one of the most important things to do as you engage in telehealth is kind of consider your priorities, what you want to get out of those telehealth sessions, and communicate, again, finding a provider that you can communicate with and kind of lay out some of those goals. Especially because we don't really know when we can return to in-person services. Depending on where you live, that's obviously very different. Try to set up a reasonable number of goals with your provider. This might just be 1 to 2 things, really, and a small, short timeline for how long it's going to take to accomplish that. It really could be a 3 to 6 month time frame for you to accomplish these few priorities that are important to you. I've definitely had a lot of families that I work with have their priorities shift since they've been at home with their kids different behaviors are coming out, new behaviors are coming out. Parents, I think, are spending more time than ever with their children, and they're also being pulled in a lot of different directions. And so new priorities are popping up. And so as these priorities pop up with my patients, I'm especially trying to figure out what are the goals we're working on now and how long do we think they're going to take to implement. We usually pick a top 1 to 2 goals, those most challenging or most difficult goals, to really prioritize and spend a lot of our time and energy on. So once you've kind of discerned that time and energy, that those priorities that you have, try to set up an environment that's going to be conducive to your child. So this may mean adjusting different things. It may be that in person you had hour-long sessions, always in the afternoon, and that worked really well. But shifting to a telehealth model can be difficult, and there's kind of innate challenges where a child's required to maybe sit in front of a screen for a longer period of time, and that's just harder for them. So kind of considering the time, the length of time of the appointment, is going to be important. So for example, instead of a full 1-hour appointment that's once a week, consider and talk with your child's provider, splitting it up. Maybe 2 30-minute sessions are more optimal. The other important thing to consider is the time of day. Given activity levels have shifted, priorities in the home have shifted, and activities in general have shifted, figuring out the time of day that works best for your family as well as the provider are going to be important. I've heard from a lot of families, working from home and having children at home is really a challenge. And as a parent, your attention is sort of constantly split. And so finding a time that's going to work for you to be able to provide the support needed during a telehealth appointment, if you do need to be there, is going to be quite important. So I encourage you to reach out to your provider or find a provider that maybe can do some flexible scheduling. These are all going to make kind of those telehealth appointments a little bit easier. It also is important to maybe place those telehealth appointments before something that maybe is desirable. So afterward, your child gets a nice reward or something fun for participating in the telehealth appointment. So we're going to take right now a quick 30-second break so that you can learn more about telehealth at Child Mind Institute, and we'll be right back to answer more of your questions. Thank you.
The Child Mind Institute is a national leader in children's mental health and learning disorders. In the face of the coronavirus pandemic, we are here to support all families. Whether you need help with remote learning, stress management techniques, or support for children who are in distress, the Child Mind Institute is available to help your family cope during this challenging time. We're here for you wherever you are. To request an appointment, visit childmind.org/telehealth.
Hi, welcome back. I'm so excited to be here with you today as we continue to discuss autism, returning from kind of these quarantines during the coronavirus, and telehealth, kind of how all of those things relate and go together. One of the questions that has come up for me a lot in my sessions with patients and a lot of the families that I'm working with is getting a child used to wearing a mask. Definitely with children with autism, those things that have to go on their faces or on their bodies can be really challenging for children. They definitely take in senses in a different way and may have different reactions to sensory experiences that we can't understand. So in talking about what we were talking about before, setting up these telehealth appointments and picking a couple of goals, a great goal to start working on with your child in preparation for going back may be getting them used to wearing a mask in public. We've talked about this a few times in some other previous Facebook Lives, but it is something that's come up several times for me in my sessions, even since then. And as we troubleshoot through some of these questions and ideas, a few suggestions for you guys that I've found to be helpful as your child might be adjusting to wearing a mask include introduce them to the mask early on. Try to find a really low stress time to introduce them to their mask. Have it around the house if you can. I had a lot of fun with one of my patients picking out a mask with them that they thought was exciting and fun, maybe their favorite color, something that they liked, maybe a favorite character, so that they feel a little bit more comfortable around the mask and with the mask. We've also had some nice success practicing wearing that mask inside in short increments. So we might be building up to wearing the mask in whole, but maybe it starts out just by having the child hold the mask up over their face like that and then put it down. It's easy to start with small goals, like holding it over their mouth for maybe just 5 seconds at a time and giving your child a reward or some kind of a token for them being able to do that successfully. Then from there, you build up to longer periods of time or different aspects of the mask. While you do this practice, it's going to give you an idea of what sort of their likes and dislikes are and what exactly about the mask they might be struggling with. So some of my patients have had a hard time with having the little loop behind their ear. They've found that to be very uncomfortable. So we've had some opportunities, because we have time and we can practice, trying to find masks that have different kinds of closures. So maybe it's finding a mask that actually ties around the head. And that's been more comfortable for the patient. And then they've been able to sort of wear it. They wear it around the house, they practice, and it's no longer irritating to them. So I suggest when you do have this time to practice, pay attention to what exactly a child is reacting to. Maybe it's really not having something over their mouth that's so difficult for them. Maybe it is having something behind their ears. Doing this practice gives you a little bit of insight into what's really kind of driving their frustration or refusal perhaps to wear a mask. Then, as you do wear your mask and you do go in public, try again to kind of build up the amount of time that you're requiring them to wear a mask for, and follow it with a reward or a reinforcer. So perhaps finally when they get back to the car and they can take their mask off, they get a reward or prize for listening and for following directions and wearing their mask the whole time. Again, this might take some practice. Anytime I recommend a family practicing things like this, I really recommend using low stakes situations. So if you know that in a month or a few months, you're going to have to bring your child out in public and they're going to have to wear a mask, start now. Start small and start taking small trips places that it doesn't matter if things really go wrong. Maybe it's a trip to the park, or maybe it's just a trip outside quickly where they're just able to practice using their mask, really building up to that bigger moment. Like I said before, this is actually a great goal and a great thing that we've worked on in session with many patients to try to get them used to this. And it is something that we've had success with, even treating via telehealth, because the child can practice with the therapist and doing it in a kind of stepwise way while they're on a telehealth like telehealth therapy or coaching with the parent as well. So I encourage you, start early, practice in low stakes situations, figure out maybe what it is that your child might be reacting to, and try to make it as positive an experience for them as possible by rewarding them, especially after they're actually successful doing what you're asking them to do. So those are just a few quick tips. I think we do actually have an article at childmind.org about this specific topic. So I encourage you to, find that article, use that information, and then do reach out if you guys have any further questions about that, because I think that's going to be an important thing coming up for a lot of children and a lot of families. Additionally, we have a question actually about occupational therapy and what that even looks like on telehealth. We've talked a lot about behavioral therapy today, so what those things look like, and then also what specific behavioral targets we can have and work with in a telehealth session, and there really are a lot of them. But it is important that if your child has other needs or is receiving other services, to consider how those things can be done via telehealth. So a parent wrote into us, what does a telehealth appointment with OT even look like? I'm having trouble imagining it. You're not the only one that's having trouble imagining that. I think a lot of folks are used to going to a gym or to a clinic to get occupational therapy, and often occupational therapist has a lot of tools and things they do with your child. They will be working on like fine motor skills, gross motor skills, or sensory processing, and they sort of have all the materials already. So in thinking about how that can look with telehealth, I encourage you first always to reach out to your child's provider. Usually occupational therapy involves a lot of activities, so it's important to ask that provider and make sure you and the provider are on the same page about the types of materials that are needed. It could be things as simple as crayons, pens, clean paper, pencils, stuff like that. And kind of having those things ready, whether it's occupational therapy or any type of behavioral therapy. I think setting up that environment to have the materials you need ready before the therapy appointment starts is going to be really important. Then also, ask your provider for maybe a schedule or something of what's going to happen. So both you and your child can anticipate what that's going to look like. It is likely that they're going to need your help. They may be asking you to put things behind your back or hold things out of reach of your child or help your child do something like scoop or write. And so having those expectations kind of laid out with the provider before the session is going to be really helpful. Something that we've done before to make telehealth sessions important, and I think this applies to OT as well, is kind of have a little preparation talk, have a little chat with the provider before, and really lay those things out. The other thing that I think could be really helpful is to, again, make sure that you're in a distraction-free environment. This is going to be important for any kind of telehealth services. So have those materials, only those materials that you need out in a distraction-free space in your house, perhaps, time of day that's easy for your child. All of those same things that we talked about earlier in regard to other telehealth appointments are going to be really important even for something like occupational therapy. So I think, though, this is a great question. All of these services can be very hard to imagine via telehealth. And thinking about then how we can go back to in-person services or what that's really going to look like can be a very important conversation to start with those providers. So I appreciate that question, and certainly you're not the only parent wondering about that. So another question that we do have lastly is also a question that I've heard several times before. This question comes from a parent who says, my son finds his telehealth appointments very frustrating. How can I help? The same things apply that I've said for the occupational telehealth appointments as well as setting up telehealth appointments. But another important thing to consider here is what is frustrating your child. Take a little bit of a inventory and think about the time of day, having a visual schedule set up for your child, explaining to your child what to expect during the session, finding a comfortable place in your home that's distraction-free, as well as a comfortable time. Adjusting any one of these things could be kind of the key to making a telehealth session a little bit more fun for your child or engaging. I think that there's a couple of different things as well to come up with themes or activities that the child might like, getting creative with the therapist to really try to improve a child's engagement in those services. So making sure they're comfortable, making sure they're doing things they like, and really trying to set up that optimal time of day and the optimal activities that are going to keep your child engaged in a telehealth session. All of those things are really, really important. So I'm really glad that we were able to address several of these questions today in thinking about telehealth services, and then also thinking about how to return to sort of a new normal, how to have your child wear a mask and help them through that is going to be really, really important. So I'm really excited that you guys tuned in today. Thank you so much for joining me. We are really happy to have you, and I hope it was helpful. Remember, we're here every day to look through your questions daily. The Child Mind Institute is here to help with mental health and parenting needs of this coronavirus crisis, no matter where you are. Please visit childmind.org/telehealth to learn more about the incredible variety of remote telehealth services that we have available during this time for children, teens, and young adults. Thank you so much, and stay safe.